Hello, welcome back again. So today we are going to discuss about micro encapsulation. So last session we learnt about the various polymers used in controlled drug delivery, and we have learnt about what is the significance of controlled drug delivery system. So today's session will start this unit 2, in which the first topic is micro encapsulation. So today's discussion is about micro encapsulation. So first of all, let us learn. So our topic of discussion is about micro encapsulation. Topic of discussion is about micro encapsulation. So why we need to do micro encapsulation? What is the necessity of using this micro encapsulation, and what are the applications we are going to gain from this micro encapsulation process? So then we are going to see the fundamental theory which is involved in micro encapsulation, its the reasons, the need for micro encapsulation techniques, and finally the application. So let us move into this definition, then we'll dig deep into the details of this micro encapsulation. So what do you mean by micro encapsulation? So it is the process where a core material is given with one or more layers of coating. So the core material, so you may wonder how this is different from tablet coating or other coating techniques. Even coating techniques is one of the micro encapsulation process. Spray drying, spray coating is also a micro encapsulation process, but the difference is it is on a micro level. So we are going to give coating for particles or droplets which are present at subatomic level in micron range, to which you will be giving a coating polymer solution such that to enhance the stability or to control the drug release or to protect the drug substance. Say for example, there is a core material which is oxygen sensitive or which is undergoing hydrolysis on a high scale. So we can give a protective coating, so on which we can provide a protective coating to protect the material, so to defend the material against the water, defend the material against oxidation. So that process is called as, that entire technique is called as micro encapsulation, and the product, the outcome what we are going to get, they are called as micro capsules. So we know about micro encapsulation and micro capsules now. Now let us see the further. Say this is the illustration which shows there is a core material inside, which is our drug material, to which you are going to provide a coating with a polymer, a coating with a protective agent, such that the inner material is not damaged. So the inner material is called as core material, and the outside is called as a coating material or shell material. So the end product what we are getting is called as micro capsules. Then, so what is the principal concepts which are involved in this micro encapsulation? So generally microparticle consists of two components. One is the inside one, that is core material. One is the outside one, that is coating material. So the inner one is protected with the help of this coating or shell material. Now let us see what is the core material, inside one. So core material is the one which is present inside, coating material is the one which is present outside. So the core material may be a liquid or solid or gas. So now you got the point. Suppose you have a liquid dosage form and it is undergoing hydrolysis, or it is not stable in liquid condition. What you can do is you can encapsulate this liquid drug molecule with the help of a polymer or other type of retardant, such that it can be protected from water or from oxygen. So even gas molecules, gas droplets can also be coated. So research is currently going on to encapsulate oxygen such that even swimmers or scuba diving people can use that oxygen microspheres under the water without the use of bulky oxygen cylinders. So that's where the research is going on. So we can still employ this micro encapsulation for variety of fields to enhance our application. So what is the composition of core material? So the core material is initially consisting of API, active pharmaceutical ingredients. So let us only discuss about pharmacy and applications of micro encapsulation in pharmacy. So the core material will be the API, active pharmaceutical ingredient, and we can also add some additives. See, sometimes if there is a liquid, in order to convert this liquid into a free flowing powder, we may use some adsorbent such as starch, or adsorbent such as kaolin or colloidal silicon dioxide, onto which the liquid will be adsorbed and above which you can provide the coating. So finally we can also add stabilizers such that your entire preparation is stable for a longer period of time. It doesn't undergo microbial decomposition or contamination. So next, so what is the coating material? So as I said, microencapsulation is involving coating of what? We'll take a core material and onto which a coating is provided. So there are two objects here, one is core material, the other one is a coating material. So we discussed about core, now let us discuss about the coating material. What are the materials which are used for coating? So inert substances, why the coating material should be inert? So it should be physically, chemically and physiologically inert, such that it does not cause any interactions. It should be inert such that it does not cause any interactions. So this is sprayed onto the core material until a desired thickness is obtained, usually 0.1 microns to 1 micrometers of thickness is used for coating, such that you will get a fine scale of micro capsules. So what is the composition of this coating material? So we will use a inert polymer like HPMC, EC, Udragit or silicone materials. We can use a plasticizer. So what is the use of plasticizer? So we are providing so there is a core material onto which you are providing a coating. So this coating, since it is spreading all over the surface of core material, there is a chance of fragility, or there is a chance of surface breaking. So this surface integrity lost can be prevented by using a plasticizer. So plasticizer will give that Young's modulus, that elastic property, such that the film can expand all throughout the surface of core material. And we can also employ coloring agents such that the material, even if it is having some unpleasant color, can be masked with the help of this coloring agent. So sometimes we can use opalescent agents such as titanium dioxide, which will mask the inner color, and what patient can see, what a layman can see from outside is a nice color, inside which there may be a disagreement of color. So apart from which we can also add resins, waxes, lipids. So as you can see, all these things are non-polar in nature. You may wonder why we are using non-polar materials. Why? Because these will repel the water molecules. These will repel or prevent the entry of water into your drug substances, such that we can have a protection, a much more added protection to your drug material, such that extraneous moisture will not enter into the core substance. And we can also add release rate enhancers or retardants. Suppose there is a drug whose water solubility is very high, so then obviously the drug is going to get eliminated from the body very fastly. In order to prevent that elimination, we can add a rate retardant such that the drug will be released slowly into the systemic circulation and it will be showing more prominent effect on the body. So that's about the composition of coating material. So I said microencapsulation is having two substances, two components. One is core, we have done with that, and we have also seen about what is the composition of coating material. Now let us move on further and see some of the examples which are used as a coating material. So we can use water soluble resins such as gelatin, gum arabica or starch, PVP. All these things are water soluble substances. Suppose you have a drug which is lipophilic in nature. See, these lipophilic drugs is having a rate determining step of water solubility. So you can enhance this water solubility by adding a water soluble resin. So inside the core material is lipophilic, outside the coating material is hydrophilic, such that you can have better water solubility in the systemic circulation. And similarly we also have water insoluble resins. So these are quite opposite. These are suitable for those drugs which are hydrophilic in nature. So if the drug is hydrophilic, so you can add a lipophilic rate retardant such that to control the drug release. And we can use waxes and lipids. These are the examples of waxes and lipids. And we can also use enteric resin. So you may wonder what's the use of this enteric resin. See, some drugs may have gastric irritation, or some drugs they are not to be intended, not to be released in the stomach area, they have to be get released only in the intestine. So in such cases we can use a entry coating material. So what's the use of entry coating material? Use of entry coating material is it will release the drug only in the alkaline medium, alkaline pH, but not in the acidic pH. So we are giving entry coating such that the material, the coating material will release the drug only in the alkaline pH but not in the acidic pH. So this is obtained zine. Zine is a wheat protein, and we also have cap. Cap stands for cellulose acetate thioate, or we can use shellac as a entry coating material such that the drug will be released only in the intestine but not in the stomach. So this is an illustration of what we learned until now. So core material, it may be a solid or liquid. Currently research is also going on to microencapsulate gas substances, so let us leave it aside because it is not widely employed in pharmacy. So we are generally using solids and liquids for microencapsulation. So we can, as a part of coating material, we are using polymers, vaccines, resins, proteins. So proteins, there is a small mistake over here. So this is your proteins or polysaccharides, and as a vehicle we can use isopropyl alcohol, or we can use a water based vehicle, so aqueous and non-aqueous vehicle. So this is the summary of what we learned until now. So this flowchart is a summary of what we learned until now. So these are some marketed examples of microencapsulation. Suppose if you take this aspirin, it is a slightly water soluble solid, so we can enhance its water solubility or we can mask its taste by using this microencapsulation. So we can coat it with a suitable ingredient, suitable coating material, such that we can mask the taste and we can increase the solubility. So there is also vitamin A palmitate, which is given as a microencapsules, and isosorbide dinitrate, which is an anti-anginal agent which will increase the vasodilation such that we can relieve the pain of myocardial infarction. And so the core must be isolated from its surroundings. So the entire need of this microencapsulation is, so your drug material is completely segregated from the surroundings. So if this is your surroundings, the surroundings are completely isolated, secluded from this core material. So that's the purpose of microencapsulation. That's what the first point says. It is it can be done to achieve any of these uses. First thing is to protect the reactive substances. Suppose your tablet is having two ingredients, A plus B, and they are reacting with each other. How you can separate? You can provide a microencapsulation to each of these drugs such that they don't react with each other. So it's like a micro room such that these drugs are separated from each other. And to convert a liquid active component into a dry solid system, you can take a very fine liquid droplet and you can encapsulate with a hydrophilic or adsorbent, hydrophilic or lipophilic adsorbent, such that you can get a micro capsule. And to separate incompatible components from for functional reasons, suppose there are two things like acid and base reacting with each other creating a salt and water, we can use this microencapsulation technique to protect each other, to prevent reaction with each other, and to protect the immediate environment of the microcapsules from active components. Suppose it is oxidation prone or it is hydrolysis prone, we can protect them by using this microencapsules. Next, it can also be used to control the rate of drug delivery. So we can prepare a sustained release formation or we can prepare a sublingual formation. So we can control the drug release by using this microencapsulation, or sometimes we can also increase the bioavailability. So the amount of drug that reaches the systemic circulation is called as bioavailability. We can promote the bioavailability by using this microencapsulation. So the technique of microencapsulation, so there are number of techniques. In the next slide we are going to see a suspension process or spray drying, spray coating, pan coating. Out of all these techniques, which one is ideal? So it depends on your drug material or your core material. Suppose you want a very high encapsulation efficiency, we'll be going for spray coating or Worcester's process, air suspension process to have more efficiency. Suppose you are doing on a laboratory scale, we'll go for solid dispersion technique or some laboratory bench scale techniques to get your product done. So the idea of what method you are choosing depends on your drug material and the efficacy you want, the performance you want, right? So these are the various methods by which you can achieve microencapsulation. So what are they? So they are mainly divided into three: physical, physicochemical, and chemical techniques. So these are quite popular. So physical methods are quite popular. So what are they? Air suspension process, centrifugal extrusion, pan coating, spray drying. In the spray drying, so there are also, depending upon how the spray is coming, whether it is coming in a concurrent direction or counter current direction or a mixed direction, it is further subdivided. And finally vibrational nozzle technique. And physicochemical, remember IC stands for I for iontophoresis, to C for coagulation. And there are also some chemical methods like polymerization. So depending upon which polymerization technique you are using, so these are further subdivided. So and let us discuss. So in this flow chart we have seen there are three mainly: physical, physicochemical, and chemical. First one is physical. So in the physical, the first one is air suspension process. So let us learn about air suspension process. So what is air suspension? So this technique is discovered by Dale E. Webster while he's working with the tablet manufacturer. So in this process, what is happening is, let me show you the equipment, then you'll get a better idea. So this is your air suspension process. So air suspension process, we have a conical assembly where there is introduction of highly turbulent air. So there is a core material. The coating solution is provided either from top side. See, this is a top spray nozzle and this is a bottom spray nozzle. So core material is provided from one direction, coating material is provided from opposite direction. So this is a counter current flow. So whatever the substances, core substances, are bombarded with the coating material such that all the drug molecules are surrounded by coating material. So why we are calling this as air suspension process is, the solid bed is fluidized with the help of critical air velocity. So we are pushing the air at a direction, at a certain velocity, such that the core materials are suspended in the air. During their length of stay in the air, they will get bombarded with the coating material. So this encounter or this interaction will result in success of microencapsulation. Each particle will be surrounded by the coating material and you'll get your final desired product. So that is air suspension process, beautiful discovery of Dale E. Webster's process, Dale E. Webster's process. So what is centrifugal extrusion? Centrifugal extrusion in the sense, so we have a centrifuge. You know that whenever a substance is rotated at a velocity, it creates an angular momentum omega. So due to which the powders are pushed to the periphery. So now this centrifuge is so designed that there is a internal perforated basket and there is an external basket which is providing the coating substance. So whatever your coating solution is there, coating material HPMC, suppose let us take HPMC, let us dissolve it in isopropyl alcohol. So that coating solution is provided from this direction. The internal basket is rotated at a constant velocity. So due to the centrifugal force, the materials will be pushed to the periphery and the coating solution is pushed inside. So there is an opposite movement of core and coating material. So this opposite movement will result in coating of core material with the substance, whatever the material, resin or polymer or retardant we needed. And the other one is pan coating. Pan coating is just like our tablet coating process. We have a pan. So this pan is rotated. Rotated at a constant RPM, revolutions per minute. there is one blower or there is one nozzle which will be spraying the coating solution. So during this rotation, all the powder bed will be coated on or sprayed on with the help of the coating material. So at the end of some cycles, like 5 minutes or 40 minute cycles, you will get your desired product with a sufficient amount of coating, desired thickness of coating. So this is a typical presentation of how the pan coating works. So there is a pan which is made up of stainless steel. Why we are using stainless steel is it is completely inert in nature, it does not react, and it is easily cleanable or washable between the cycles. And there is this powder bed, this is your core material, and the coating solution is pumped into this pan into this pan with the help of this air atomizing nozzle. So lesser is the pores of this nozzle, higher will be the atomization. More and more amount of droplets of coating material will fall onto this powder bed, and you will get a very fine grade of coating. So that is pan coating apparatus. And spray drying. So spray drying, it is like, so there is, so let me show you the equipment. So spray drying apparatus is consisting of spray drying and spray congealing. Let me show you the equipment. See, this is your fluid. Okay, so spray drying apparatus, what it will comprise is, it will be comprising of a conical apparatus, so where your powder material is circulating in a spirular motion, it is moving in a spiral motion. So during this motion there are nozzles. So these nozzles may be continuous nozzles, or there may be only one nozzle at the top or one nozzle at the bottom. So during this rotation of the core bed, powder bed, these nozzles will spray the coating solution. So air is being circulated, the powder bed is moving into the air, and your coating solution is sprayed onto that core material, your solid material. So finally at the end you are going to get micro capsules which are surrounded by the coating material. So that is spray drying. So there is one more thing we need to learn. So what is the difference between spray drying and spray congealing? So both are similar, the entire operation or the equipment looks similar. Spray congealing is, instead of using liquid or fluidized bed, we will be using melt. So we will be using a melt. So you can imagine this as a molten lava. So if the consistency of your input is more thick or more high, it can be taken as a melt, and the process can be named as spray congealing when compared to spray drying. So we got two, spray drying and spray congealing. So air, when it is in circular motion, it can be given in any direction. It can be given in a concurrent direction, or it can be given in a counter current direction, or in a mixed flow above and below. So vibrational nozzle. So there are some disadvantages associated with spray drying or pan coating. The process of desired thickness may not be consistent with the spray drying or pan coating, which can be prevented by using this vibrational nozzle technique. So let me show you the apparatus such that you can have a better idea. So there is a nozzle over here which is moving at a frequency which is having that longitudinal wave frequency, so due to which there is a production of compressions and rarefactions, and when the fluid is moving in between these electrostatic electrodes which are providing charges. So suppose the material is positive, our coating material is positive, we will provide the coating material in negative. So we will choose opposite charges. We know that opposite poles attract each other, unlike poles attract each other. So once this material is passing into this zone, so the coating material, the negative charge will be attracted onto this positive charge. So what you finally get is a tight interaction between the core and coating material. So when compared to the previous process, it's all about physical. So this one, due to the electrostatic charge, will have a tight bond between the core and coating material. So the disadvantages associated with spray drying, pan coating can be overcome with the help of this vibrational nozzle technique. So this one is vibrating such that all the heavy density and low density particles are equally pushed into this region where there is an interaction between the coating and core material. So inotropic gelation. So what do you mean by inotropic gelation? So as the name is suggesting, so we are using two different chemicals which are opposite in nature. So in this example, we have taken the example of sodium alginate and calcium chloride. Suppose let us take your drug material and dissolve it in some solution like sodium alginate. So you are going to take your drug and dissolve it in sodium alginate, and above you are providing calcium chloride solution. So from the above you are providing calcium chloride solution. So there is a reaction between calcium chloride and sodium alginate. So there is a double decomposition reaction which will result in displacement of calcium ions with sodium. So what we will get is calcium alginate. So this calcium alginate will be hardened. So once the solution, calcium chloride solution, falls into this drug plus sodium alginate mixture, it will result in the formation of calcium alginate. All these calcium ions are replaced by this sodium. So we will get calcium alginate, so which will result in hardening. So your drug material will be hardened, all the coating material will be hardened onto the drug material. So this is inotropic. So since two ions are being displaced, sodium with calcium, it's called as inotropic gelation. Since after interaction they will form a gel, tight interaction gel. So that is inotropic gelation. And the other one is coercivation. So next technique is coercivation phase separation. So this is discovered by B.K. Green and his associates. This is discovered first by B.K. Green and his associates. Coercivation phase separation can be explained by this illustration. So what we are doing is, first of all, the core material is taken. The coating material, whatever the coating material is there, it is dissolved in some solvents like isopropyl alcohol. It will be dispersed uniformly with the help of a stirrer. In the third step, we are going to add some electrolytes or surfactants or non-solvents. So due to the presence of these electrolytes or non-solvents or surfactants, the coating material will not stay in solution. It will come towards this core material. So this is your core. All the coating will deposit on the above side of this core material. So what you finally get is a tight core and coating interaction. So you'll get microencapsules which are deposited with the coating solution. So this is coercivation phase separation. Why we are calling as phase separation is the use of electrolytes and non-solvents are separating the phases, separating the dissolved substance from this liquid phase onto this solid phase. Since it is involving separation, we call this technique as phase separation process, coercivation phase separation process. So solvent evaporation. What do you mean by solvent evaporation? Very simple. So we are going to take drug. We are going to take a coating material like HPMC or EC, whatever it may be, to which we are going to add solvent such as isopropyl alcohol or acetone. So later we are going to employ heat, temperature to evaporate or completely remove isopropyl alcohol once. So this initially consisting of three: IPA, HPMC, drug. Now since IPA is evaporated away, what we are left with is HPMC plus drug. So where drug is your core material and HPMC is your coating material. So we are achieving coating by evaporating the solvent. Hence this technique is called as solvent evaporation technique. So this is solvent evaporation is quite popular. It is nowadays also it is being used by this NCR company. So this Gravato photo production NV company. So whatever the films, photo films we are getting, so previously without the advent of digital films, we used to get the photographic films which are actually prepared by this solvent evaporation technique. So pharmacy also we are using this solvent evaporation technique a lot, especially in the laboratory bench scale. Next is polymerization. So this is an example of chemical technique. Polymerization is an example of chemical technique. So we can take the monomers, we can use some chemical reaction like oxidation, reduction, hydrolysis, etc. We can build all the monomers on to form a huge chain polymer. This polymer will trap the core material inside. So outside we'll get this polymer coating, inside the core material is trapped. So the idea is you are going to dissolve your polymer whatever the monomer units in a solvent, and we are going to trap your drug molecule inside that polymer molecule. So this is all about chemical reaction. So there is a chemical interaction involved, like oxidation, reduction, hydrolysis, or other sorts of chemical reactions. So we can use a matrix type of polymer. So what's the difference between matrix type of polymer and reservoir polymer? So reservoir, in the sense, the entire drug material is loaded with a limiting membrane. So once this polymer is lost, all the drug will come outside. That is called as dose dumping, which will result in toxicity. In order to avoid that, we can use a matrix polymer. Matrix polymer is looking like a mesh. Each mesh net will encapsulate one single drug molecule. So with that, your drug will be slowly released into the systemic circulation. So what are the applications? Finally, we are concluding this microencapsulation by learning about the applications. We can use the microencapsulation technique in the agricultural field. How? So we can use insecticidal sprays. So insecticidal sprays, if they are sprayed as a liquid, those droplets will get accumulated in the environment, may cause biomagnification and human toxicity. In order to prevent that, we can use this microencapsulation technique, and we can avoid the fertilization process in insects, such that they are going to kill each other. They are not going to vegetatively propagate, and they are going to die by themselves. So by using this microencapsulation technique, we can prevent the spread of mosquitoes, spread of pests, etc. In chemistry, in chemical fields, or in fertilizer fields, etc., they are used for catalysis. So if you are using with a large particle size, catalysts won't work nicely, but if you are using microencapsules, the activation energy required for chemical reaction will be lowered, which will result in faster rate of chemical reaction. It will increase the rate of reaction. So instead of waiting for 2 to 3 days, Haber's process, production of ammonia, they'll wait for 3 days. But by using micro encapsulated enzymes, we can get our product just within 18 hours. So that's the advancement. So we are saving time, we are saving labor, and we are also saving money. So that's the use of micro encapsules. So food industry, not only in the agricultural and chemical fertilizers industry, we can also use it for food products to give a good taste. So bakery products, they are given that spray coating, that sugar solutions are sprayed onto them to improve their elegance, to improve their attractiveness, and also taste and sweetness of the preparation. Finally, how microencapsulation is useful for a pharmaceutical scientist? It is used to produce different drug delivery systems. So for targeting, suppose there is a cancerous drug, instead of having cancer drug all throughout the body, we can target this cancer drug only to the area where tumor is present. So that is called as drug targeting. We can achieve drug targeting by using this microencapsulation. We can use one target material. You can use it for active targeting or passive targeting by loading them with antibodies or antigens, such that your drug material is going to go and sit directly on the site where cancer is present. We can prepare entry-coated tablets, we can prolong the drug release. Whatever we learnt during our introduction is same repeated again here for applications. And these are all some other advantages. We can use microencapsulation to prevent tackiness, to prevent adhesiveness between the granules, and promote the flowable property of the drug molecules. And it can also be used to protect your drug materials from heat, temperature, etc., especially vitamin A, D, E, K. We can protect them by using this microencapsulation technique. So all these are applications. So using this so we learned that microencapsulation is not only used in pharmacy but also in other fields. So it is better that we learn the different microencapsulation techniques, such that we can succeed in the pharmaceutical industry. Thank you all of you. We'll meet in the next session.